Only phrenic nerve.
Yes,
Right.
but there rest. Where is the rest from your list? We added this from list.
Is it added?
The
Okay,
nerves.
it's okay for you. I think I have the specimen where is visible the transverse cervical, the greater auricular nerve from the cadavers what we have from the pink dissection room. So I show you this nerve and we add, after I show you, you add from your list this nerves. From this muscle, you remember here has the innervating, the double innervating, yes? So this is the question from the written test. And this innervating, here you see which nerve pass through the common part of the sternocleidomastoid from the near to the mastoid process. Which nerve? The 11th cranial nerve. So this is the accessory nerve. Yes? Now, I marked you. It's possible marked from the intercranial way and the extracranial from the extra cervical way. So this is the external branch or the accessory nerve. Yes, that's it. So here you have the branches. This is still the accessory nerves. Innervate the fibers, the belly of the sternocleidomastoid muscle. And the next one is the trapezius.
Yeah.
Yes, so the trapezius from this cadavers is visible here. Trapezius muscle. Yeah? And the next
Platysma.
here, yes, is visible. So this one is a platysma. Maybe I show and I mark like this. And from the platysma, you remember this one is what? This is the vein, facial, and the artery vein. The facial artery pierced the platysma. And which nerve pierced the platysma? You remember? Here is visible. This is the place where goes the nerve. Which nerve passed through the platysma and innervate the platysma? This is the external branch of the facial nerve. Yes? Because the facial nerve innervate all the expressions of the face muscle and the platysma through the external branch. So this is the place where is to answer correct, like the platysma and the external branch of the facial nerve. Where I mark like this, platysma. Where I marked here, yes, you must be careful. You must look which structure is the first pierced. So now you have the facial vein. Yes?
Yeah.
Okay. And here you have the facial artery. This one. Facial artery. This. Facial artery, facial vein is here. And
Temporalis.
temporalis muscle from this cadavers, yeah. Now, temporalis and probably masseter, yes?
Yeah.
Yeah?
Yeah.
Okay, so masseter muscle. And
Buccinator.
what?
The buccinator.
Buccinator muscle. Yes, but not this specimen. I show you the buccinator muscle. Here is the buccinator. But I don't know. Maybe I do not mark this, but you have from the list. Why not? Yeah.
The mentalis.
Mentalis muscle. Change position. Here, mentalis, yes.
Depressor labii inferiors.
Depressor labii inferiors. This one.
Levator anguli oris.
Here. And the levator, probably the superior, yes or
Yeah.
not? This one.
Zygomatic major and minor.
This one. Minor. Major. Oh yeah, here is visible. Look. This is the minor and the major. You see? These two? Minor and major. Here is the visible, yeah.
Orbicularis ocular.
Oculi, yes. Like this. But which part is here? Orbital part, yes? Maybe you add this information, which part, or not?
No.
Yes, no, 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 okay. Orbicularis oculi.
Constrictors.
Constrictors of the pharynx. Yes, the pharynx. Constrictors, the pharynx, pharyngeal muscle, but I try to move from the isolated, from where I have isolated the larynx. Here is visible, but I don't know, maybe I do not mark from this specimen. No, from the, from the separately the larynx. So you must remember what I show you, yes, from the isolated larynx. Here, sorry, this one specimen has the muscle constrictors. You see, all of this, is constrictors. So this is the superior constrictor. This one is a middle constrictor. This one, and here you have the inferior constrictors of the pharyngeal muscle, and here you have the gap, 3. Yes, so which nerve passed here? You see, the superior laryngeal nerve. Go through the piriform recess where we have the fold. Yeah, and the next one.
So then artery is the right common carotid.
Yeah, so maybe we concentrate from this canal. And of course this, because you must know what we have from these projections. Okay, so the common carotid artery, right and left, you must recognize, because this artery is a difference from the diameters, yes, and the originate part. So this is right, left common carotid artery. From this specimen, look, you see this artery. Where we have the common carotid artery? This one is a common carotid artery, yeah? And here you have which vein? The jugular vein. So this is the internal jugular vein, common carotid artery. So now you know here these structures, what pass here must be the which nerve? Vagus. Yes, because this is like the neurovascular structures pass together. And here you have the superior part of which cartilage? Thyroid. This artery, common carotid artery, here splits the two branches. So this one must be the internal carotid artery, and here you have the deeply, now from this projection, external carotid artery. So this is the place exactly here, but yes, is visible. No, here, no, it's visible. So this one is the external, yes, external carotid artery, and this one is the internal carotid artery. And the internal carotid artery, where is it possible to mark the internal carotid artery? Here, maybe, but no, because is possible marked here, but it's not easy, yes, to recognize. Here you have which structure? This one is the cavernous sinus. So you know the internal carotid artery passed through the cavernous sinus. So here is the part, the cavernous part of the internal carotid artery, but no, I think from the part where it goes from the neck. And the next one?
Subclavian artery.
Subclavian artery, yes. Here is the subclavian artery, right? And here you see the left subclavian artery.
Vertebral artery.
From this pelvis and from this canavers.
Will we have the same cadaver for the...
Yes.
Like, will
This,
we use
number
it?
15 and number 28 from the pink dissection room.
Okay.
Only these two cadavers I used during the practical test.
Okay.
This specimen and the sagittal projection from the fresh head. Yes,
Okay.
we have. Only this we use. What do you see during this tutorial and the electives, okay? I promise you.
Okay.
We do not
Okay.
give you the fresh new body. And this one is a vertebral artery. Now you see the vertebral artery here. And the vertebral artery is possible marked where? Here, where it goes from the foramen magnum. Yes, so this is the vertebral artery. You see? Yes. This one. Yes. And
Thyrocervical trunk.
thyrocervical trunk. nice not to prepare this more. Here's this one is the thyrocervical. You think I marked this? No.
No.
But it is here, yes, it is visible. And this thyrocervical trunk here splits the two branches like the transverse cervical is visible here. Yes, this one is the transverse cervical artery, and this one is the superior suprascapular artery. You have suprascapular artery from your list? No, maybe we
Transverse cervicalis.
transverse cervical here. This is the place. Here's the branches. You see this small branch? Here is a continued here. This is not the transverse, yeah, you see? This one is a branch of the suprascapular branch. And the suprascapular, of course, here is visible the vein, yes? And this is the transverse cervical vein. And the next one?
Inferior thyroid artery.
Inferior thyroid artery. I see here the inferior thyroid artery, and here is this one, yes. Here is inferior thyroid artery. It's visible. Yeah, this is the artery, so it's possible to mark. And the next,
Superior thyroid artery.
yes, this one is the beautiful artery here from this specimen. So if you look, see, and if you see this specimen and this artery, the superior thyroid artery, I give you the